Assalamu alaikum and welcome to the Dr. UUT channel. In this video we will talk about the load, preload and afterload. This lecture is available in Urdu, so let's commence in English. Preload and afterload. As you know, the blood when enters to the atria, then to the ventricle. This entered blood from the inferior and superior vena cava, when it is poured to the atria, then it will enter to the ventricle, and this entered blood will cause a pressure on the ventricle. Due to which what will happen? The ventricle's muscle fibers will stretch. So now this blood is actually exerting a pressure on the ventricle fibers to stretch. This pressure is actually called as preload. So this preload will increase when there is large amount of influx of the blood. Physiologically, you can say when there is a increased venous return, this will cause increase in the preload. And if there is decrease of the venous return or there is less blood available, then it will cause a very less pressure. So decrease in venous return will cause decrease in the preload. Increase venous return, increase preload, decrease venous return, decrease preload. And let's come towards the left side of the heart. Here we have the ventricle. So when the blood exerts a pressure on the ventricle and it resists the contraction of the ventricle somehow, a little bit. So this pressure of the blood to resist the contraction of the ventricle is actually called as afterload. In short, what increases this afterload and what decreases this afterload? It depends upon the arterioles. If the arterioles constrict, there will be a kind of pressure exerted on the ventricle. Then the ventricles will work harder in order to pump the blood from the ventricles to the whole body. So now arterioles are a kind of, you can see, obstacle. If this arterioles constrict, this will cause increase in the pressure, and that pressure will be exerted by the blood on the ventricles. So like this, you can say the arteriolar pressure, when it is increased, it will cause increase the afterload. And when the arteriolar pressure is decreased, it will cause decrease in the afterload. So that's a little bit about the preload and afterload. If still you have any kind of question, you can drop that in the comment box. We'll come to answer the questions very soon, inshallah. Thank you for watching.